Welcome to On the Line. I'm Christine Williams. Coming up, getting through the tragedy of someone close to you committing suicide. Stay tuned. Some facts about the tragedy of suicide. Canada ranks in the middle of 22 Western industrialized countries. Approximately 23 people for every 100,000, around the middle or so. 18 of those are male, 5 female. Those numbers are alarmingly significant, and we shouldn't pretend they don't exist. For the family, the impact of a suicide is nothing less than a nightmare. People naturally think it couldn't happen to them. Reality doesn't bear this out. Not only do these loved ones have to deal with the grief of the death, the psychological trauma is indescribable on many levels. Today we're dealing with how to continue coping when someone close to you commits suicide. You don't want to miss this. Most of us know someone or of someone who has. Joining me is Dr. Bill Webster, a grief counselor. Later on, you'll meet another guest whose son committed suicide. Remember, our lines are open for you to call in with your questions at any time during this hour. Dr. Webster, thank you for joining me today.
It's always a pleasure, Christine. Thank you for having me on.
Now, Bill, suicide is a devastating subject. From what I'm hearing, February has been loosely dubbed as Suicide Month, referring to the high numbers of people that do commit suicide in February. It's a reality that's existing today. There is an intense grief involved, but somehow, and I've heard this from you, Bill, there's a difference when it comes to suicide specifically. Can you go over this with us?
I think February is a difficult month for many people. Many doctors would say that it's because of the lack of light and the seasonal affective disorder, SAD.
Yes.
And so, you know, traditionally, February is a bit of a depressing month anyway, you know,
Yes.
especially after the winter that we've had.
That's right.
So it's not surprising that that would correlate with some of the figures, because obviously when people are depressed, that's a time when something like this might be considered. It's also very interesting. I appreciated the statistics that you brought to us, and it's true that probably 4 out of every 5 suicides are male. So 4 males for every 1. And yet even more alarming, more females attempt suicide than males. It's just that males are more successful for, if that's the correct word,
Yes,
it's probably not a very appropriate word, but men tend to sort of fulfill the purpose and go for it. And so that's a frightening statistic. In North America, there's 1 suicide every 15 minutes. But for every suicide, there's 15 attempts. So every minute, someone somewhere may be attempting this. Now, I've had the privilege of being here before, and I've talked about grief. And as you know, I believe that grief is a natural response to an unusual event. So grief is a reaction to the fact that someone has died and we miss them. But I think that qualitatively, the grief after a suicide is very different. First of all, because it's by choice rather than by chance. Someone has made this decision. So I think as a result of that, often people will struggle more with guilt and anger and blame, saying, well, what could I have done? Why didn't I have an opportunity to do something or to say something, to prevent this? Did I miss something? Maybe there was something that... And so the person will often torment themselves with that. Also, I think, because the death is sudden and unexpected, just the shock of it, there's no preparation. And so often people have to prepare themselves for the event after the event. And so the person may be numb for quite a long time. And that's not to even go into detail about someone perhaps coming home and finding a loved one, which is an absolutely horrendous concept for anyone to even begin to come to terms with. So all of these things, I think, really make suicide a very complicated grieving process.
From what I understand too, and if you could expand on this, the anger component of this is a very real one.
I believe that anger, guilt, and blame all come out of the same root. And the root is our feelings of helplessness and powerlessness. So when something like this happens, when a loved one takes their own life, we feel helpless. And we say, well, what could I have done? Often anger gets misplaced. I'm angry at this, I'm angry at that, I'm angry with the doctor, I'm angry with the hospital, I'm angry with everybody. But the real source of the anger is that there was nothing I could do. And I think that's part of the difficulty of suicide, that the choice has been taken out of the survivor's hands. There was nothing that they were able to do to prevent what has happened. Therefore, out comes the guilt, out comes the anger, and out comes the blame.
What about the what ifs and if only I had done this or I should have done this? Do you see a lot of that, Bill? Because I can see that really leading for an individual in this position to total torment in that person's life.
And I think it can do. Again, you see, we would like to think in life that we can control things. We'd like to think that we can handle things. Here's a problem. Okay, here's what we're going to do about it. Here's how I can handle it. When someone commits suicide, the option, the possibility of doing something is taken away. So the issue, and this makes sense to grieving people, what do you do when there's nothing you can do? Because after someone dies, there's nothing you can do. So what can I do? Well, if only I'd done something, if only I'd done this, if only I'd done that. And people beat themselves up because if there's something I could have done, if I could have prevented this, this gives us a sense of control. People would rather feel guilty than feel helpless.
Yes.
And so it's really a reaction to say, I don't want to feel helpless, so what could I have done? I could have done that, so I'll feel guilty, I'll blame myself, I'll punish myself. People would rather feel guilty than feel helpless. And I think it's a very, very important point to encourage people to say, hey, sometimes things happen. And the reality is, Christine, is whether we like it or not, if someone makes up their mind to take their own life, there's nothing that anyone can do to prevent that. Once someone has made up their mind, you know, it's very, very difficult because that's, if you like, that's the curse of it, that the power and the control has been taken out of the hands of the person who would love to do anything, who would just love to help.
But yet, Dr. Webster, I would imagine it takes getting to a certain point where the person or the survivor realizes, wait a minute here, I have to let go of this. Yeah. As simplistic as that sounds, to be able to move ahead in life, to be able to go on coping, there must be that point, Dr.
I think
Webster.
we'll be hearing a little later some of the ways that that can actually happen, and that'll be good. But I think that's absolutely right. But again, at first, just coming to terms with the unreality of it. And particularly because it's often a traumatic death.
Yes.
Most suicides that occur involve firearms or suffocation or drug use, in that order. And so, you know, it's not a pretty picture. And so often people really have to come to terms with just the reality of it before they're able to kind of, you know, put it to one place where they can then begin to look at other issues of how to go on living.
Wow. Dr. Webster, this is a tough topic today. You've also talked about in the past the stages of grief. This particular type of grief takes on a different tone within itself, something we'll be talking about later on. And in the next segment, you'll also get to meet a fellow that we're going to interview, Fred DeFrancesco. His son committed suicide. We'll hear about his story. And once again, our phone lines are open. If you have any questions, please don't hesitate. Give us a call. We'll be back after this. Stay tuned. Welcome back to On the Line. I'm Christine Williams. Not an easy subject matter we're addressing today. We're talking about suicide and grief. Joining us today is Dr. Bill Webster, who is a grief counselor, and also joining us now is Fred DeFrancesco, whose son committed suicide. Now, Fred is going to tell his story. But before he does so, we're going to go now to Singh on line 3. Hello, Singh. You're on the line.
I'm expert on suicide regarding the children. And it's a negative stress and positive stress both that causes the suicide symptoms. Positive stress is just like going to work he doesn't like. Negative stress has many reasons. So one of the best reasons is socializing. If you don't socialize, if you don't talk to somebody, if you don't talk to your mom, if you don't talk to your teacher, and teachers and parents are both responsible when they want to see the symptom in their children, and it begins at schools. And socializing is very important for young kids and young children. If they don't socialize, the whole thing goes when they grow up, when they go to colleges, universities, or somewhere else, and it remains effective. It's called anger management,
Yes.
and it's controlled by sun rays.
Singh, do you have a personal story at all in this?
Yeah, because I was very young, and
Yes.
I've seen somebody committed suicide,
Wow.
and he talked to me. He talked to me about the anger, and the anger contains sex and neglected by the students, by the fellows, by the classmates, and neglected at home by parents.
Wow. Singh, thank you so much for calling in. Dr. Webster, can you address Singh's point of view
I think
here?
what Singh is saying is very, very important, and thank you very, very much for the call, because I think that's absolutely right. That often, if a person feels isolated in some way, that really contributes to the problem. If a person has someone that they can talk to and share and get a different perspective and so on, I think it's very, very valuable. And I really appreciate the comment. Thank you very much.
Yes. Now, Fred, we really appreciate you joining us today, because you don't come here today to tell an easy story. It's been a nightmare for you. I tried to capture that in the introduction, but obviously that's a grave understatement.
It is. It is indeed an understatement, and hopefully no one has to go through this nightmare, but those that are going through it, of course, I hope that we could bring a little bit of light to their life.
Fred, tell us your story.
Well, my son Michael committed suicide in October of 2005. Michael was a wonderful young man. He had just turned 27. Always wanted to be a pilot. Did become a pilot, graduated, worked for a small aviation company in the western part of the province. Unfortunately, 9/11 hit, and of course it damaged the airline industry tremendously. In Canada, he lost his job, and at that particular point, I saw him sliding a little bit. And being able to recognize depression, I recognized it very, very early. And of course, as a parent, you try to intervene as much as possible, but at the same time, it's a silent illness. And it's like going to an alcoholic and saying you drink too much. The alcoholic, of course, will look at you and say, no, I don't. An individual with depression is basically the same unless that person recognizes the situation and you're able to bring that person to some sort of treatment. That person is not going to get better on their own. Michael got worse and worse. He did recognize the illness about 6 months before he passed away. But I think at this particular point, it required a little more than just discussing the situation. It required medication. It required just a little bit more. But I thought we had it under control a couple of months before he passed away. He unfortunately took himself off medication, and just a few days after that, he passed away.
Oh dear, Fred, the devastation is just, you can't describe it. In the moments that followed that, the days, the weeks, the months, how did your family cope? How did you cope as a dad, first of all?
I'm coping today the same way I coped the day after. It doesn't change. What has helped me a lot, more than anything else, are friends and colleagues. They have been absolutely fantastic.
Wow.
I just can't explain to you the strength these people have given me. The reason I think many of them have given me the strength is because I openly talk about it. I have to talk about it because it helps me. It's therapy for myself. As well, it opens the door for others to discuss it with you as well. A stranger or a friend is not going to approach you as a true friend and discuss suicide if that friend knows it may harm you or it may hurt you. Of course, if you open the door to them, then you've got a friend on the other end. You've got a shoulder to cry on.
Fred, I'm so happy you're mentioning this because what you're saying there is so grounded in across-the-board research that the worst thing a person can do is isolate themselves at a time like this. So you reached out for help, Fred. It couldn't have been easy to do this.
The first person I reached out for help was this gentleman right here, Dr. Bill, of course. And Dr. Bill answered a few
Excellent
questions.
help.
Excellent help is right. And he answered a few questions that I had, excuse me, and, the whys of the world, and what else could I have done, and so on and so forth. But my greatest strength, besides Dr. Bill, of course, has been, as I said, my friends and colleagues. There isn't a day that goes by, Christine, where I don't get a phone call from somebody to say, hey, how are you doing?
That is fantastic.
I think this is very important, Christine, because whether it's Dr. Bill, which is very nice, and I'll buy you lunch after that, Fred, thank you. But whether it's a professional, or whether it's friends, family, colleagues, whatever it happens to be, it's talking about it. The principle is that which cannot be put into words cannot be put to rest. And so Fred was able to begin to verbalize, to talk about that which was unspeakable and unthinkable, which helped him to begin to accept the unacceptable and believe the unbelievable. So I think Fred's telling us something very important here about his process and how just everyone in his office and people around him actually helped him to do it. And there's not anyone watching here who can't do exactly the same thing for those around who they're concerned about.
Fred is a definite survivor. It comes across loud and clear, Fred. But there's one question I'm going to ask you. And through the years, we've interviewed people here who've been through many tragedies. And there's one thing that I've heard that I'd love you to deal with here. When a person goes out and tries to get support, perhaps the first person they may not walk into, or they walk into, may not be a Dr. Bill Webster. It could be somebody else that perhaps shifts the blame back onto you. So there's a risk whenever you decide to put yourself out there with your story, there's a risk on what you'll be met with. Can you address this, Fred?
Well, I think the first, if you're going to seek help, I think the first thing you do is you go to a professional.
Yes.
I think that's first and
Excellent.
foremost. I think if you go to perhaps a friend, friends are very sympathetic, don't get me wrong. Sometimes family may not necessarily be. There might be blame thrown. Professional is who you should see first.
That's a great word of
and
advice.
sometimes the family themselves is suffering just as much.
Of course.
And so it's like how can we support each other when we're both broken, and we sometimes pretend we want to be strong for each other, but it's sometimes very, very difficult for families to be able to be that kind of support for one another.
You can imagine a family all asking the same questions. Why? Who to blame? Anger? Well, it's very difficult to have one of these people,
definitely.
of course, discuss the situation and try to console you. It's just not going to happen. I think you've got to deal with yourself first. How am I going to deal with this alone in a locked room at nights? And you're going to have to go to that professional first. And depending on your friends and colleagues, people will react to it differently. People will deal with it differently, depending in the profession you're in, the trade you're in, whatever the case might be.
Profound information given today. We're talking about the difficult subject matter of suicide and grief. We're going to be going for a break now, but when we come back, we're going to continue to talk about the stages of grief as it pertains to suicide. We'll get back to you on the phone lines, and Fred brought along some pictures he'd like to show you of his son. We'll be back after this. Stay tuned. Hello again, and welcome back to our talk. We're talking about suicide and grief today. Joining me is Dr. Bill Webster, who is a grief counselor, and Fred DeFrancesco, who was, just before the break, telling us the story about his son who committed suicide. Now, we're going to go on with that shortly, but first, we're going to go to you now, waiting on the phone lines. Camille on line 6, hello, you're on the line.
Hello.
Yes, go ahead.
I call for my granddaughter.
Mm-hmm.
And she's very upset, and she talking about a lot of time to commit suicide. and I'm very nervous and I'm concerned. I don't know what to do.
Just for how old your granddaughter, Camille? How old is she?
18.
She's 18? Okay. Dr. Webster.
I wonder if I could ask Camille, what are some of the things she's saying? Can you give me some examples of some of the things she's...
Yeah, she go to ballet, and the guy from the ballet, the teacher, she says she's too short and she can't gain weight, she can't eat, and she go to high school and she's so depressed because she wastes a lot of time at the dance, and the guy he said to her she's not too good. After 10 years she danced, and she's so depressed she don't know what to do.
So I hear you saying that some of her hopes and dreams of being a dancer seem to be being dashed, and I think that's a very, very significant thing, because especially, you know, as a teenager, you know, we set our goals and we have these high ambitions, and I think the thing that we need to say to you, Camille, is that we should always take these things seriously. We should always, you know, because sometimes people say, oh, well, you know, if they talk about it, then they're not going to do it. That is actually a myth. People who talk about it sometimes end up doing it. They don't necessarily, but always listen to the person. Because sometimes by talking about it, by responding, by just sharing, you know, your disappointment about the loss of her hopes and dreams, by communicating, by letting her know that someone cares about these things, that these things are important, I think that's a very, very important thing. And the fact that you're so concerned, and the fact that you've heard her in what she's saying, to feed that back, take it seriously. I mean, there comes a time when maybe there may be a need for some professional intervention or whatever, but, you know, you listening to her, you sharing your disappointment with her, you sharing her disappointment with her is, I think, going to be very, very important.
When a person is young, or no matter how old, in the case of your son, people can believe, well, if their hopes are dashed, right here and now, they feel that it's that sense of hopelessness that does it.
It's called existential despair. It really basically means that when a person comes to the place where they no longer feel that life is worth living. So someone gets a disappointment, like, I'm not going to be a dancer. I no longer feel like life is worth living, but there are other things for which life is worth living. And it's being able to sort of share and to show the other good things, the talents that she has, the things that she's able to do, the positive things about her. This is a beautiful person. I think we live in this culture of beauty and attraction. It's the Barbie syndrome, you know, that if you're not a certain size and a certain weight and a certain height, that you're rejected somehow. Well, that's a complete and utter myth, and we need to really fight that with everything inside of us and say that everyone's accepted, everyone has their place, everyone has their gift. So maybe not in this area, but maybe in another area, and to encourage a person to kind of maybe see things from a different perspective would be very important.
Yes. Now, Fred, you were going to say something.
Well, I think Camilla is dealing with a situation very similar to what I had to deal with. The thing, Camilla, is that you are a very lucky woman, because you're able to do something about it now, and you've recognized what the problem is. Like your granddaughter, my son Michael, who was a pilot, perhaps saw himself losing that dream if he had to go on to medication and what have you. And if you recognize this early, perhaps you can take Dr. Bill's advice, because there are many other careers and many other things a young person can do, and deal with it now.
I think the two of you will agree, too, that there is a lot of help out there, both in the form of counseling, and once again, I know that a lot of people do not like medication. It continues to be a controversy today. We see reports about it on both sides, supporting it, not supporting it perhaps, but there are cases where people need medication, period. And unless your medical doctor tells you to come off your medication, please listen to his advice. This is not to stop you from getting other counseling and pursuing other methods, but there's a danger attached to just stopping taking medication.
And I think that's right. And as you know, I'm not a medical doctor. Neither of us have any medical education.
I've spoken to so many.
What we're saying is that they should check in with a medical doctor. I think there's just maybe one other thing, though. and that is that we're dealing with a teenager here.
Yes.
And it's fine to say, well, get help, get them to a professional. It's very difficult for a teenager to get help. And I really actually feel that Kamel can be a large part of the thing here by
yes.
caring and
Grandparent.
by letting this person know that she cares. Because often the real reason that a person commits suicide is to end the pain, to get rid of the suffering. And so by sort of sharing that I care and maybe we'll find a way through this and give some hope, I think is a very important component.
I'd like the two of you to start addressing the area of the stages of this type of a grief as it pertains to suicide. But first, Fred, you brought some pictures of your son, and I'd like our audience to have a look at those pictures. If you can just, as we show them to our audience, tell us what they are. Here's that first picture. Tell us about it, Fred.
Well, that was the day my daughter got married, and Michael was an usher.
And that's your son.
He's always been the tallest one in the family, which is
Yes.
wonderful because I'm the last to know when it rains. I'm so short. But
And there he is again. We have
this
a
was
close-up.
Michael at Island Air. Michael was an instructor there when he no
Wow.
longer flew in Kitchener. And a very well liked individual. And this picture was taken just in the backyard. One day he had come back from a flight, I think, in the U.S. and we were having a barbecue. And this
And
is
there's you
myself and
there,
him
Fred,
in the
yes.
house. We were very close. We spent a lot of time together.
Wow, beautiful pictures, Fred. The stages of this kind of a grief, I
think I kind of rebel a little bit against the idea of stages. as you
Define
probably,
stages,
Yeah, define
yes.
stages. I think, if you take all of the theories from Kubler-Ross to all of the different systems, including my own, it really boils down to three words. The first word is avoidance, the second word is confrontation, the third word is reorganization. I think that what makes a traumatic death, like a suicide, unique, is that there's what's known as a cognitive dissonance. In other words, it's just unbelievable. This just can't have happened. And so I think the avoidance is often prolonged. As I said earlier, often people have to prepare themselves for the event after the event. So in a situation such as a suicide or a homicide, a violent death, a sudden unexpected death, the person may seem numb for longer. So the problem in our culture, of course, Christine, is that people confuse numbness with strength. Oh, you're doing well. Boy, you're really handling it. Boy, you're not as bad as we thought. This is great. We're relieved because you're not going to be a problem for us. It's often 3, 6 months down the road, a year down the road. There's no actual time frame, but the avoidance until a person is able to psychologically prepare themselves to be able to say, I need to confront my loss and begin to reorganize to make the most of what I have left.
Wow, Dr. Webster, you're giving us some amazing information here. We're going to have to go for a break again. We'll return after this. Stay tuned. Hello again, welcome back to our discussion. We're talking about suicide and grief today. Now, Dr. Bill Webster is joining us, a grief counselor, and Fred DeFrancesco, whose son committed suicide. Now, we were in the middle of talking about the stages of grief. Now, Bill, you don't quite like phrasing it as stages because there are definitely, you're going to notice differences across the board with different people, but you talked about the basics. We're going to be getting back to that shortly, but first, let's go now to Marilyn on line 7. Hello, Marilyn, you're on the line.
Hi, Christine. Thank you for taking my call.
You're welcome.
I don't have a very good connection with my phone, so I hope you can hear me okay.
Oh, we can hear you loud and clear, Marilyn.
Okay. My question is, well, first I want to say that I was married to a man for 25 years. When he was 11 years old, his father committed suicide with a gun. He said that they left the house one night. There was a fight between him and his mom, and they left, and when they came back, he was dead. He never seen his father, and he never went to the funeral. I don't know. He can't remember. He thinks he wasn't allowed. And then it was never talked about in the family after that. my question is, how does that affect a marriage later on, and also children in a marriage from this sort of thing? And I just want to make another comment that 8 years ago, his mother died in a very tragic accident, car accident, and 4 years after that, his brother committed suicide. So he's gone through a lot, but I feel that it did affect our marriage. I feel that he was very distant from us, and I don't know if my gut feelings are right. He said he did grieve it, and that was all there was to it.
Wow. Marilyn, those are devastating tragedies, and I will tell you, the audience, that this very question that Marilyn is asking, that could take an hour in itself. In fact, months perhaps to answer adequately. I think I'm fair in saying that. There's no easy answer. First of all, we're not presenting that there is, but I will ask our guests to give some guidelines. You've got many components in there, Marilyn. Which one of you would like to start this first? Because it seems like the avoidance stage comes in loud and clear here.
I think after a death, first of all, you have to understand that there's damages to yourself as an individual, of course, having to deal with it, but there's also collateral damage within the family as well,
Yes.
that we don't talk about enough. Here we have a situation with Marilyn where her husband is dealing with a death perhaps in his own way, perhaps she's dealing with it differently, and I mean, this is why we're talking about this, because various people grieve differently. There are those that avoid it, as Dr. Bill said, and there are those that come out and discuss it, and there's those that seem to get a little bit better, that seem to deal with it a little better, and those, of course, that have that facade, that numbness you were talking about, that you say, well, they're all right with it, but are they truly dealing with the situation? I think perhaps that's what Marilyn's going through right now.
Mm-hmm.
I hear Marilyn. I mean, I hear her hurt. I hear the pain that she's expressing here. And, you know, I think it's always difficult for a child to lose a parent by suicide. It almost sets a model. And so, you know, when I hear, well, the parent committed suicide and now a brother has committed suicide, they say that suicide runs in families. It's not genetic. It's often that's the model that was set. So if it was good enough for dad, it's good enough for me. So this is part of the difficulty.
But a parent that commits suicide, if I can interrupt you for one moment here, wouldn't that translate into an abandonment from the child's point of view?
Well, of course. I mean, and I think particularly at age 11, that's particularly difficult.
Yes.
Because as an adolescent, your father represents your model into manhood, if you like.
Your identity.
You haven't gotten to 16 or 18 where you're sort of arguing with the parent and everything's big. I mean, this is your model. Mm-hmm. This is your hero in many ways. And so I think this happened at Marilyn's husband at a very, very difficult and crucial time in his life. And I think that's right. Sometimes in that generation, in order to spare the child the grief, we kept them away from funerals. We never talked about it. Well, the child then, if something's a secret, or if a child's been left out of something, they tend to internalize and blame themselves. Mm-hmm. It's not a fact. And you know, up here you would say, no, that's not the thing. But deep down, you see, well, I've been left out of this. Nobody talks to me. Nobody mentions. I must have done something to do this. We were talking about this idea of helplessness and powerlessness. Yes. And I think it's only fair to say that it may actually not be a marital problem. It may be a grief problem. So I would really encourage Marilyn to really see if there would be some way to get some help for her husband in terms of dealing with the grief. You know, because if we understand the root of the thing, then other things may then sort of just be able to focus on the marriage, may not be the crucial issue.
Even attachment issues, I would imagine, from something like this, from an early childhood.
Exactly, that's right. I mean, if a child of 11 is abandoned, it's very difficult to commit yourself to something.
Yes, Fred.
I would hate to look at this as a fact that a child looks at it that they have been abandoned. I think what's important to look at here is that the person who committed suicide had an illness. And that illness probably didn't allow this individual to think properly. Mm-hmm. So that individual, I'm sure, didn't look in the mirror and say, I want to abandon my family.
No, but children do. According to fact, children do.
That's right.
Yes,
the
children
effect
do.
on the child.
This is facts
but
here.
still it comes down to education.
Yes.
Why is it that we are not going to individuals and saying, look, Mental illness is an illness. It's a broken leg. We
Great
fix
point.
broken
Great
legs.
point.
Mental illness, we look at it from the point of view, oh, he was crazy, or whatever the case might be. I think we have to educate our young people. And
Definitely.
I think CAMH is doing
Definitely.
a fantastic job today with all the publicity that they've got out there. We have to educate them to be able to recognize depression. When a young person can recognize depression within their own friends, my God, that's the greatest support that friend can have.
To reach out.
And to
Yes,
reach out
that's
is
right.
absolutely
That's right.
correct, not
That's
after
right.
the fact.
Very well said. We're going to go for a break now. We'll return after this. Stay tuned. Hello again, and welcome back to our discussion. We're talking about suicide and grief today. Let's go now to Jude on line 4. Hello, Jude. You're on the line.
Hello. Good
Yes, go ahead.
Hi. I have a question for Dr. Webster. Dr. Webster, I have a son-in-law who committed suicide last August, and my 13-year-old granddaughter has been getting counseling weekly since that time at her school, and she seems to be dealing with this much better now. But my daughter has been avoiding counseling, and she's actually just started going to counseling yesterday. I'm just wondering if you can tell me what I could do to best be supportive for her at this time.
Wow, Judy, great that you called in.
Thanks a lot, Judy. And you know, I'm also going to ask Fred, because having been through something similar, I think he can answer quite a bit. It's great to hear about your granddaughter, because I think that often peer support is very, very important in these kinds of situations. And there are organizations like Bereaved Families out there who offer this kind of support, and through the schools. This is wonderful. Regarding your daughter, I think one of the most difficult things is the realization that you can't help someone until they're ready to be helped. And so I think all we can do is to support them, to love them, to let them know that we're there for them, to listen to them, to constantly just, not to keep after them, not to nag them in any way, but to just let them know that we care about them, let them know that when they're ready to talk about it, that we would be willing to talk about it, to remember specific days that might be difficult for her, such as birthdays, the wedding anniversary, you know, the first day of the Blue Jay season, whatever happens to be significant days that would be there, to just a call, a card, a lunch, a coffee, to keep letting your daughter know that you care and you're there and your mom and so on. And then when the time comes that they might ask for counseling or for support programs or whatever, you'll be there to actually find it. Sometimes people will go to websites and or read information, get education about this, and these things can be helpful.
Fred, you want to add to this?
Well, I think the best thing Judy can do in this particular case is just to wrap her arms around her daughter, tell her just how much she loves her, and then step back a little bit, because as we're talking about today, each and every one of us deals with it differently. And I'm glad to hear that her daughter, of course, now is getting some counseling, because that's a step in the right direction.
Fred, not everybody does the survival thing like you did, and you reached out, and that's the best thing you could do, not isolate yourself, but go out there and get support. For a person who doesn't do this, for people like Judy, that they want to help, but a lot of times people want to help, but they just don't know what to say. One of the things I've heard of, even in grief in general, Bill, and if you can verify this, and I've heard this said, that people want to hear the name of their loved one that has passed away, whereas people might think, I don't want to mention that name because I might offend that person, or I might just bring back up wounds, which, by the way, are there anyway. What can a person do? Somebody who's watching that says, look, I know somebody who committed suicide, and I just want to be there, but I don't know how. I don't know how to bring it up. I don't know what to do, so I stay quiet.
Well, it's like what we talked about earlier. If the person that is grieving isn't doing it, I don't want to use the word publicly, but if they're not opening the door, then it's very difficult for the friend to come and open up, as you just mentioned, Christine. So everybody deals with this differently, and unfortunately, you don't walk up to someone who's grieving and say, "Hey, open up and talk to everybody about it." that either has to be a natural instinct on the part of that individual, or professional help will assist that individual.
But can you tell the person, well, look, I'm here? Like, is there some way that perhaps you could offer that person?
That's better. See, I don't like to tell them anything. I might say something like, would you like to talk? If the person says yes,
because some people need that,
then we talk. If the person says no, then you say, well, look, if there ever is a time that you would like to talk, I'm here for you. Okay, it opens the door and it says to the person, when you're ready, you come on through, because I'm here and I'd love to talk, but when you're ready. And so, would you like to talk? Yes, then we talk. Would you like to talk? No. Well, you open the door, because later on the person might say, now who can I talk to? And I remember Christine said that, and before you know, then that person is doing that. So
and combining that with what Fred said about a big hug, just be there for the person.
That's right.
Just be there.
That's right. Being there is I think, the most important thing of all.
And there are no time limits on grief. This is something that needs to be understood.
I think Fred can talk to that, actually, because he's got a lot
That's
of
going to be,
comments.
actually, Fred, a great point to come back to. We're going to go for a break. We'll be back after this. Stay tuned. Hello again, welcome back to our discussion. We're talking about suicide and grief today. Now, Fred, you were on a point before we went for a break when it came to, again, dealing with others in the grief process.
Well, as I said earlier, and I'm sorry I don't really remember exactly what point we were on, but as far as dealing with others, if you, the grieving person, can open the door to others, then others will, of course, approach you with comfort and what have you. If you don't open that door, if you're not able to talk about it, and we have to recognize we're all different. Not everybody is going to go out there, open the door, and talk about it like I am perhaps today. There are members in my own family that won't discuss the topic.
You made a great point in the break, though, that I think needs to get out, that people sometimes tell you all kinds of things. The time limits on grief we were talking about before we came back here, which I think is so important. But people can tell you something like this, oh, that's over, the person, don't worry about it, it's long gone. And people mean well, you were saying in the break.
Yeah.
So if you can just carry on from that point of view.
Well, I think you have to recognize that if you do in fact have friends and somebody approaches you and says get over it or move on, they don't mean it in a malice way. I think you have to sit down and examine yourself and how you're taking that comment and put yourself in the other person's shoes. Well, what did they really mean? Are they just trying to make me feel better? And I think if we look at it that way, every comment that comes to us will be an acceptable comment.
Dr. Webster,
but
though,
on the other hand, may I say, I think that sometimes people's expectations of how quickly we should get over it or get ourselves together are unrealistic. You never get over it.
No
it
time
affects
limits.
us, it changes us, and I think people need to understand that suddenly I'm different, and my life has changed. And there's no time frame. I'll never be back to the same again.
That brings us to those points. We talked about the avoidance stage. It came through loud and clear today. The confrontation, facing it head on. Is this what you mean by confrontation there, Bill?
I think it's confronting the reality of the fact that my life has changed, that a loved one has died, and there's nothing I can do about it.
And the reorganization.
And the reorganization is really coming to the place where you say, well, I have to make the most of what I have left. Because one of the temptations is that we can spend so much time grieving what we've lost that we don't appreciate what we still have, and we've got to focus on that.
Fred, are you there?
It's difficult to say. I do appreciate very much everything I have, and especially everyone around me. I mean, I have a tremendous appreciation, as I mentioned earlier, for friends and colleagues. To move on, I think you're living a different life when something like this happens.
You've reorganizing.
You've become a different person. You're into a different life. The goals are no longer the goals you had before. For instance, having a son, living vicariously through him, of course, watching him become a pilot, doing this. Well, that's gone. So what you do is you now separate yourself from that reality, and you move into another reality with perhaps fewer goals up ahead, or perhaps no goals up ahead whatsoever.
It's that letting go.
But may I just say
Yes.
that I'm very proud to have Fred as a friend as well as a client.
Amazing inspiration.
Because what this man does is he reaches out to other people.
Yes.
And so people who've gone through a similar situation, Fred reaches out to them, and there's an identification, because it's fine if Bill Webster calls because, well, Bill's a counselor, but Fred, who's been through the experience, calls and connects, and I've called on Fred several times. Could you call so-and-so? Could you call such and such? It's called a survivor mission. It's trying to make the most, trying to find some meaning out of a situation that doesn't seem to make any sense. Something meaningful has come out of it, even though the situation still doesn't make any sense. And that, I think, is where we really find reconciliation.
The uniqueness this is what came through to me here today, the uniqueness of individuals when it comes to coping with this kind of a tragedy. Fred is the kind of a person that he confronted it. Not everybody is that way, though. And I'm glad that Fred could get out there, and you, Dr. Webster, and encourage people to deal with it on this level.
I think Fred hit it head on, and I think that he did a wonderful job in doing that. And, I encourage people, reach out, get some help. Don't keep it to yourself. Share it with other people. There are groups and organizations out there that can help people in a situation like this.
Wow. Great, positive words of wisdom to remember. Dr. Webster and Fred, it's been a pleasure having you both today. Thank you so much for joining me.
Thank you very much, Christine.
And that's all the time we have for today. See you again next time. I'm Christine Williams, and from all of us, thank you for watching.